Good morning. Welcome to Carolina People. This morning we're at the Holiday Inn, Hard Rock Parkway. We're focused on HIV and AIDS in the African American community, and we're visiting with the Region Director, Region 6 Director for the Department of Health and Environmental Control, Dr. Covia Stanley. Good morning, Dr. Stanley.
Good morning. How you
Thanks so
doing?
much for coming in early on a Tuesday morning.
Okay.
A lot going on. I'm sure things keeping you busy, but to come in
Yes.
here, and this is a real serious issue.
It is very serious.
Something that a lot of folks, I don't think, understand the significance of the numbers there and how it's just critically ripping through parts of the community, but particularly the African American community.
That's true, yes. Certainly, as we were talking earlier, we know that HIV and AIDS has grown in epidemic proportions, particularly in the African American community. The African Americans are about 13% of the population, yet we make up about 49% of those folks who have newly acquired HIV and or AIDS. I must make a distinction. HIV is the human immunovirus, which eventually can lead to the AIDS, the acquired immunodeficiency syndrome.
Right.
And we know that people who develop HIV can live a long time. Magic Johnson is a typical
Great
example.
example. Yeah.
Yes. What I want to focus on, though, is trying to help people not to get that.
Right.
We are living in a time where sexuality is not looked upon as something that can be potentially fatal. You've heard the reports in the last month or so about teens 1 in 4 having STD. And
Is that right?
Yes. And when we think in terms of STD, of course, that includes gonorrhea, syphilis, chlamydia, herpes, HIV, and AIDS. And of course, we have to include hepatitis C, which can be very debilitating to young people. And the interesting thing about it is the HIV and AIDS can be prevented. We have the education, we have the medication, we have condoms and other modalities of therapy. But we just need to get it in folks' mind that I must make this positive change. For too long in the African American community, we have not talked about sex as we should. And we know that in the churches, people just do not want to talk about it. But I'm here to say that as a seminary educated pastor, as a gynecologist, as a healthcare professional, we need to let folk know that we must talk about sex in the church in a culturally sensitive way. We need to get our heads out of the sand because young people are having sex now between 3 and 6 o'clock in families' homes. And many times they do not think that it's going to happen to them. They practice this philosophy, it's not going to happen to me. Invincibility.
Yes, which a lot of teens, a lot of others, a lot of adults clearly feel that way.
And
clearly feel that way. And of course, I've got to highlight that great example you just laid out. A lot of folks that are MDs themselves, gynecologists would be particularly, if that's all they did, they'd be particularly capable of speaking about this. A lot of pastors, if that's all they did, they'd be particularly capable of speaking about this. If they were healthcare professionals or DHEC directors, they'd be particularly capable. You wear all 3 of those hats, all 3 of those hats. So what better person than to talk about this issue than someone dealing with folks both on Sundays and every day of the week when you're reaching out with the Lord, both on a healthcare side as well as a person who's obviously practiced and seen a lot of special situations with women and men as a gynecologist and obstetrician.
Certainly we cannot educate enough, and as we were talking earlier about the pets, you know, I think that's very appropriate prevention. education, treatment, and support. Over the past few years, we know that people who have HIV or AIDS have been stigmatized.
Right.
You know, as queers and other names. And
sure.
People have said that they're the scum of the earth, and
right.
They got it. God cursed them because they did not act right. But the point is that some people got it being innocent. For example, Arthur Ashe got it through contaminated blood transfusion.
Right.
So we who do not have it are just blessed at this time.
Right.
What we want to emphasize, though, if you know that you are engaging in activity that could be very possible for you to pick up AIDS or HIV, it'd be best for you to refrain. And what we do recommend is having a monogamous relationship.
Right.
Of course, first of all, for young teens, we recommend abstinence.
Oh, yeah.
When that cannot be practiced, of course, we do recommend the use of condom.
Right.
And certainly the latex condom, in contrast to the sheepskin, because the latex does have the closer pores so that the virus does not pass so readily. And of course, as I talk about the use of the condom, it will help contain the virus which is in the ejaculate.
Right.
And as I tell folk, people talking about withdrawal.
Oh, yeah.
The fact is that first ejaculate is heavily loaded.
Is that
with
right?
The virus.
With all the virus.
Yes,
wow.
Yes. And
it's important that viewers take the time to sit here and listen to this, because obviously they're not hearing it oftentimes in church. They're not hearing it in their homes. They're not hearing it necessarily at school. They may hear it at DEC, or if they go to pregnancy support service type locations, they may be hearing this. But it's important at 7:10 a.m. on a Tuesday morning, if they want to rush off to work, that they find a way to get back to somebody like you or to Care Team, another great group, to learn more about these basic things. They better start thinking about them, because if it's not happening to them, it's going to happen to a neighbor, it's going to happen to a loved one, it's going to happen to one of their children potentially, or their grandmother. I mean, one of the startling facts that Johanna Haynes gave us recently when filming with us at HTC was the idea that 11% of new cases are heterosexuals over the age of 50. And you sit back, how is that possible? And the idea was a lot of folks married, split up, they've been in monogamous relationships for 10, 20, 30 years, they split up, now they're out dating. They're not used to having had any protection for years. Easy to fall in that trap and easy to pick up AIDS, pick up HIV and later AIDS.
Yes, and where Ms. Haynes is referring to, certainly, as I remember, the 60s. You know, basically the STDs was gonorrhea, syphilis, and you could treat that easily with penicillin. And now, as we said, we do not have the monogamous relationships, and of course you have the additional burden of HIV, chlamydia, and all these other viruses, hepatitis B, hepatitis C. And the sad part about it is that our behavior is so, I guess, liberal right now that we have sex with 2, 3, 4 other people. Each of those persons had sex with that many people. So by the time this 55-year-old lady who is divorced or a widow has that one time with that hump for women, and of course for the man, the bad mama jamma. You know, you know, they have sex with somebody who's had it with several folks, and it just increases the chances for that one time.
Big domino.
Yes, big domino. Yes. And the sad part about it is that they don't think about this, and it progresses so that it does become AIDS. And I'd like to think and focus on the pathology. Once this virus gets into one's system, over a period of time, it breaks down the immune system, what we call the reticuloendothelial system, which are the plasma cells, and the cells in the bone that are generated, the white blood cells.
Right.
And we have special cells that come from the bone or reticuloendothelial system, such as the plasma cell,
Right.
the lymphocyte, which eventually become broken down, weak, and they cannot fight the germ as they formerly did.
Right.
And therefore the immune system just becomes so weakened. So we have a low T cell count. The viral load is increased.
Right.
And all that. And so all these, as they add up, makes it difficult for the patient to begin to have good quality life. And we thank God that they do have medications now that help folk to live longer, in contrast to several years ago where people were destined to die, prematurely.
Right.
And so we know that we must help people to understand, particularly the seniors. You have to know what the serum level is of your partner. There's nothing wrong to ask, have you been tested?
It is Johanna and I talked about that off camera, the difficulty of that aspect if someone is going to not abstain first, if they've decided they're going to be in a relationship, monogamous hopefully, but possibly going into multiple relationships, just to make sure and ask that question, whichever side you're on. If you're the male, ask it, have you been tested? If you're the female, and you hate to say it, but oftentimes just making sure they really have. I mean, or go together. Go together. Because ultimately, if you find it out, you can possibly treat yourself earlier, and then the support begins to kick in. Supporting your loved ones, because of course, as you said early on, that aspect was this was always a homosexual man's disease. Now you give examples like Magic Johnson. He's not a homosexual. Arthur Ashe, clearly getting it from another thing and not it. But even if they were, it's not just a homosexual man's disease. Clearly, a lot of women, the highest incidence now in young African-American women. And she gave those figures, and they're startling. CareTeamSC.org, CareTeamSC.org. But still, the other special thing there, and I understand you're with DHEC and clearly as a pastor, so you're speaking about it for wearing a lot of hats, but wanting folks to get in and get tested. Just get tested. And they can do a swab now. The swab in your mouth.
Oraquake is a good way to test, and we thank God for people being able to go to places where they can be anonymous testing. Because I know that stigma. You go to that van or go to this site, people automatically assume. But certainly prevention, as they say, is worth a pound of cure. And we just can't emphasize enough to everyone who is in a relationship that's not monogamous to check yourself. And of course, as a gynecologist, I know that the American Medical Association back there about a decade ago has really encouraged all physicians who are taking care of women to at least offer them the HIV test annually. As a gynecologist, a woman who comes in with chronic moniliasis or candida vaginitis or yeast, that it should raise the antenna that she must be tested to rule out being HIV infected.